I thought about viral bronchiolitis in children. I am Paola Benítez Rosado. I study in Catholic University School of Nursing St. Vincent of Paul. Definition: bronchiolitis is a lower respiratory tract infection that occurs in children younger than 2 years old. It is usually caused by a virus. The virus causes inflammation of the small airways. The inflammation partially or completely blocks the airways, which causes wheezing. This means that less oxygen enters the lungs, potentially causing a decrease in the blood level of oxygen.
RSV bronchiolitis is a serious threat to the health of infants and young children. Based on historical estimates, it is the leading cause of infant hospitalization as well as the leading cause of infant viral death. RSV lower respiratory tract infections lead to epithelial necrosis, with the loss of ciliated cells, smooth muscle constriction of the airways, goblet cell proliferation with increased mucus production, and parabronchiolar inflammation and edema. As a result, function during RSV lower respiratory tract infections may be significantly compromised, leading to difficulty breathing and decreased systemic oxygenation.
Application in medicine. Treatment of chronic bronchiolitis in pediatric patients include REDS, use of antipyretics, acute irritation and avoidance of smoke. Analgesics and antipyretics target the symptoms of pediatric bronchiolitis. In a chronic case, bronchodilator therapy should be considered. Oral corticoids should be added if core contains as the history and physical examination findings suggest a worsening form of bronchitis.
When she heard a loud noise coming from her little baby, it gave Mom Lawrence Motrilla cause for concern.
It was almost wet sounding, like down in her chest. You could really feel it when she coughed, and that was the most alarming.
It's the number one reason infants are taken to the hospital. Bronchiolitis, or childhood bronchitis. It's caused by an infection of the tiny airways that lead to the lungs, called bronchioles.
The virus causes inflammation in them, and as a result of that, bronchiolitis, it's seen in kids causing quite a bit of respiratory difficulty.
Almost every child under the age of 2 gets it at some point. The virus presents with coughing, wheezing, and shortness of breath. Unlike a cold, which is usually gone in about a week, bronchiolitis can linger for weeks before going away. Some children are at high risk for severe cases that require hospitalization.
One that have lung problem, the one who were born with the heart abnormalities, the one that have immunological abnormalities, or the very premature kids. Those are the ones that we see getting admitted to the hospital.
Fortunately, by the end of week 2, baby Scarlett was on the mend. Her sickness nearly as hard on Mom.
We stayed pretty calm throughout it, but still disheartening when your baby gets sick and is not feeling well.
Doctors say if your child ever has difficulty breathing, it's important to seek medical help immediately. For Lee Memorial Health System, I'm Amy Osher.
Pros and cons. Bronchiolitis usually affects children under the age of 2 with a peak age of 3 to 6 months. Viruses that can cause bronchiolitis include adenovirus, influenza, and parainfluenza. The virus is spread to infants by coming into direct contact with nose and throwing fluids on someone who has the illness. This can happen when another child or an adult who has a virus sinuses or coughs nearby and tiny droplets in the air are then breathed in by the infant, touches toys or other objects that are then touched by the infant.
Parents have been asking me to lend them a hand as to whether or not their babies are developing something called bronchiolitis. Well, I don't want anyone to get choked up about this particular illness, so let me provide some information. Bronchiolitis is an inflammatory illness of small airways called bronchioles that go into the lung. It's not just about inflammation, but about mucus buildup as well, making it very difficult for children and infants to breathe with this illness, especially babies who've been born premature. What causes bronchiolitis? Well, it's a contagious illness caused by germs and viruses, which means it can be spread by coughing, sneezing, or touching a baby. There are lots of viruses that cause this illness. Influenza is one, and the most common is something called respiratory syncytial virus, or RSV. This disease comes in the winter and can last 1 to 2 weeks. How do you know your baby's getting bronchiolitis? Well, we're going to start with a runny nose like the common cold, but that's going to develop into lots of congestion, a fever, cough. You may even hear wheezing as if your baby had asthma, but it's a little early for us to diagnose asthma. What can we do about this illness? Well, we need to be providing supportive care to our babies, which means good hydration. And if babies are having difficulty breathing, you need to suction out their noses. And if the mucus is too thick, put a few drops of a salt water solution in the nose and then suction out, and your baby will feel better. If that doesn't work, talk to your baby's doctor, because he or she may want to put your baby in the hospital on occasion to help with hydration and to help with that breathing problem. Can we prevent bronchiolitis? Well, like any other kind of respiratory or cold infection during the winter, the best thing you can do is good hand washing, cough on your sleeve or elbow, and certainly keep children and infants away from environmental tobacco smoke. There's also an injection you can give to babies born premature, but you need to talk to your child's doctor to see if your baby qualifies for these injections to reduce the risk of bronchiolitis, so that hopefully tips like this will allow you to breathe more easily when it comes to knowing more about bronchiolitis. This is pediatrician Dr. Lewis First from Vermont Children's Hospital, Fletcher Allen, reminding you to always be first with your kids.
Conclusion. Most cases of bronchiolitis cannot be pregnant because the viruses that cause infection are common in the environment. Careful hand washing, especially around infants, can help prevent the spread of viruses. Bronchiolitis is a common cause of illness and is the leading cause of hospitalization in infants and young children. Treatment includes measures to ensure that the child consumes adequate fluids and is able to breathe without significant difficulty. Most children begin to improve 2 to 5 days after first developing breathing difficulties.
In children, we don't see a lot of bronchitis. Most of the children that are having these attacks of bronchitis are short, quick asthma attacks. So anytime someone's child is being diagnosed with bronchitis, just keep asthma in the back of the mind. However, in kids under 2, we often see a very close disease called bronchiolitis. It's very, very, very common. In the winter months, we're seeing dozens of kids with bronchiolitis each day. And so typically they're caused by a virus. You've probably heard of RSV or respiratory syncytial virus. Human metapneumovirus is another one. So these viruses in young infants will cause a lot of irritation to the breathing tubes. And a lot of the cells within the breathing tube die and fall into the middle of the breathing tubes, as well as mucus that's produced. So you have a lot of this junk in the middle of the breathing tubes. So they have wheezing like asthma, and they also have this wet, phlegmy cough that can be diagnosed as bronchitis. But it's actually a disease called bronchiolitis, and the treatment is a little different than even asthma or bronchitis.